From the Youth Science Council, this is Good Question, a podcast about science in the UAE. I'm your host, Sara Shirbaji. Today we speak to Dr. Fatima Al Dhaheri, a pediatric infectious disease fellow at Boston's Children's Hospital, a Harvard Medical School teaching hospital. In this conversation, we talk about Dr. Fatima's personal interests, her views on public speaking as a medical professional, medicine, and in particular, vaccination, and her subspecialty, pediatric infectious disease, amongst other things. Without further ado, here is our conversation. Welcome to the show, Dr. Fatima.
Thank you guys for having me.
Of course. All right, let's start from the beginning. Can you tell us a little bit about yourself?
My name is Fatima Al Dhaheri. I am a UAE graduate. So I did my medical school in the UAE, graduated in 2013, left to residency after that, did 3 years of pediatric residency at Children's National Medical Center, George Washington University affiliate, and then I am currently in my fellowship, which is subspecialty, at Boston Children's Hospital, which is part of a Harvard Medical School teaching hospital. And that's sort of me in a nutshell. I have different sides of me, but that's my doctor side.
What other sides at least stand out, do you think?
I'm a writer,
nice.
Self-proclaimed poet.
Okay.
I've been writing English poetry since I was 13.
Nice.
So that's another side of me.
Have you written any books yet?
I haven't written any books. I've written blogs.
Do you like to write short stories?
Mainly poems.
Okay.
And I contribute to an awesome female Emirati writer community called Entitled Chapters.
Oh, nice. I know about that.
Yeah, they're pretty cool. They keep me sort of in check of my poetry side when I'm sort of in my doctor zone. So.
And what kind of stuff do you like to write about? What are your main themes?
I write about everything. Some writers or some poets write about their personal experiences. I don't. Not that I don't. I do write about my personal experience, but I'm one of those people who are like virtually in coffee shops, people watching. I'm not technically doing that, but I like to think that I am. Human beings in general fascinate me. Their stories fascinate me. And so my muse is just regular people and their stories.
That's
and
amazing.
So, yeah.
And then that really perfectly complements your doctor side, right? Because this kind of gives you a narrative
exactly
in the lives of people.
Exactly.
Right?
And it's exactly why I chose medicine. I mean, it is the epitome of humanity.
Okay.
There's no place on earth where you see sort of the spectrum of humanity, and it's in the hospital. You see the birth of life, you see the death of a human being, and all in between. They're at the most vulnerable. You see sort of all the colors of emotions and experiences that they go through. So it is the other coin. It's the flip coin of being a poet, a writer, and an artist. So medicine is art.
Wow. And I can imagine that's pretty overwhelming, huh?
It is because in order for you, I'm addressing both sort of being the writer and the doctor.
Yeah.
In order for you to be a good writer and a good doctor, you need to let people in.
Mm-hmm.
And that sometimes that entails being a little bit vulnerable. I mean, as doctors, we're trained to sort of keep sort of a wall up, and not because we don't want to connect with our patients, but it's because we see so many patients, and if we don't sort of self-preserve, then we get easily burnt out. But that's exactly right. It can be overwhelming. And
this helps you deal with that.
Writing is a good it's a good sort of venting system, and then just constantly reminding myself why I'm doing what I'm doing, and patients and their stories. I'm always reminding myself that it's an honor and a privilege to have people let me in, and at their most vulnerable sort of phases in their lives. And so it's constantly just reminding myself that as much as I respect other professions, but I don't see myself doing like an 8-to-5 desk job. I can get easily bored. So I think it's exciting. I think it's intellectually stimulating. I think it's also spiritually and soul stimulating as well. So just reminding myself that I'm lucky to be doing what I'm doing. So
awesome. So I'm going to ask you this question. It's inevitable that I ask you this question, but most of us, our familiarity with medicine, alhamdulillah, does not come from inside the hospital, but rather through TV. So I'm a huge fan of Grey's Anatomy. I'm curious if you watch House, maybe. I mean, House is such an intellectually stimulating show.
Yeah.
And if being a doctor kind of looks like that, then I'm sure, it's a...
Yeah, funny story with the show House. It was one of my favorite shows ever.
Yeah.
And I started watching it as I was like really early on and like graduated high school and then just went into medical school. I was 17 years old, and I would watch it with my sisters, and then as I progressed in my sort of medical school levels, I would start criticizing the show. I'm like, we don't do this. We don't, we don't get a brain biopsy just to like diagnose a future problem. So, and my sister would get it. I'm like, why can't you just like watch the show and enjoy it? So yeah, it's not, doctors don't, I think we just spend time critiquing the show rather than enjoying the show.
Yeah.
And it's funny. I used to watch a lot of like law-based shows,
Yeah.
and it would like talk to my lawyer friends. I'm like, oh, like Suits and like all these shows. I'm like, yeah, that's the And so it's interesting. I used to watch House. It's an amazing show.
Yeah, just not very technically accurate, it seems.
Absolutely not.
Surprisingly. Yeah.
We don't go around, doing brain biopsies left and right. That is not true.
Right. So what inspired you to study medicine then? I'm guessing not House. But, what inspired you to study it and later specialize in pediatric infectious disease?
Because of my, I was a writer before I chose medicine. I actually wanted to study English literature.
Oh. Okay.
And then I think the change of heart came after it was 2006, and there was a lot of things going in the region, a lot of instability, and that was the first time I learned about Doctors Without Borders, MSF, Médecins Sans Frontières.
Nice.
And just learning about them, just like, getting to know their mission and how powerful it is to have doctors in the field without an actual hospital, with an actual structure, just reaching out to those people. And I, I really wanted to do something like that. So I think it was actually MSF that got me, that sort of switched my gears towards medicine from English literature. And then it was like a point I remember, like in 2006, where I was trying to write, as a writer, trying to express sort of what I'm feeling with everything going on, and trying to sort of capture what, these refugees were going through. And then I realized there are people in the ground just doing this amazing work. And I'm like, I can be the writer, but I can also be that person in the ground doing that stuff. So
wow, it's a pretty powerful story.
Wow.
I remember once I think I heard a story from a doctor who was working on the border of Serbia and Bosnia during the war, and she was talking about triage. And I think that was extremely frightening to me. So it's really interesting to see that you found this compelling and that you wanted to be the person doing that. Whereas my experience with it was absolutely terrifying to hear, that doctors would have to make such difficult decisions. It's like, I would never want to be that person making these, calling these sort of shots. But it's amazing to hear you kind of have a completely opposite experience and find that extremely compelling.
Yeah. And it's not like I saw them. I'm like, I want, like, at that point, I didn't know if I could be them. If that makes sense, but I wanted to be in their world.
Yeah.
It's
amazing.
So,
yeah. Right. And so what is pediatric infectious diseases, and what does this subfield of medicine encompass?
So pediatric infectious diseases is a subspecialty of pediatrics. So the specialty of pediatrics is the medicine of children. And sometimes, that age extends because you have childhood onset diseases. So sometimes we follow young children to young adulthood. So that sort of, it's not like we only see less than 18. That sort of age creeps up as medicine advances and these childhood onset illnesses, these children grow up. The specialty of pediatric infectious diseases is basically everything that entails in terms of infectious diseases. So viral infections, bacterial infections, parasites, how they interact with the immune system and how they manifest. And infections manifest everywhere. You can have brain infections, joint infections, heart infections. And I think that's what attracted me because in residency, I felt like I couldn't commit to one organ system, right? I would go through my neurology rotation. I'm like, the brain is super interesting. And then I would go into my cardiology rotation. I'm like, the heart is also interesting. And I'm like, I don't see myself committing to one organ system. I loved sort of the puzzle work. Infectious disease doctors tend to be known as the Sherlock Holmes of medicine. House was an infectious disease doctor.
Yeah. I mean, when you were saying that, I was just imagining how the doctors were breaking into people's homes and like studying whether there's mold in their walls to kind of pin down the source of the infection.
And that's what
do you do that too?
And then, well, we don't break into homes, but we ask exposure history. So we are the kind of doctors when we were consulted, we would ask like odd questions like, where's your water source? Have you consumed unpasteurized dairy in the past 3 months? Where have you traveled? So we are the doctors who sort of think globally about the patient and think beyond sort of the organ system. And we're involved in all of the body, right? Because infection can hit any part of the body. And I think that's what it's exciting about infectious diseases.
Yeah. What are some of the most common cases that you've come across?
I mean, it depends on sort of the child. So because I'm a pediatric infectious disease fellow, I see pediatrics, so children, and ranging from what we call the bread and butter of like common cases to the complicated cases. Because of the advances of medicine, I work in a large tertiary hospital, so we see sort of infections that come with chronic diseases. So children who, because of advances in medicine, would have otherwise died in infancy are surviving, but that means they're surviving. They're sort of delayed physically, delayed their milestones, and they have those infections. And then, we see infections in people they have intact immune system and infections with kids that don't have intact immune systems. And that area is a whole other world because the infections in that population where your immune system is not working properly, that's a whole other world, and that's a whole other, challenge of atypical infections.
What are usually the sources of these infections? So maybe like in utero as a sort of.
So when
is that possible? And then also going into like after being birthed, you can contract an infection.
Exactly. So so in pediatrics, you can get a congenital infection. So it can come from mom to baby. They can acquire infection postnatally, so after birth.
Yeah.
They can acquire infections as they grow up, and then it depends on their immune system. If their immune system is good, they can fight infections well. If their immune system is not then they have their own sort of set of infections. And right now, because of the huge advances in cancer care and organ transplantations, these kids live longer, right? And where they could have easily died, but now we're dealing with more atypical infections.
Oh wait, can you tell me more about this organ donation?
Yeah, it's a topic very close to my heart. The UAE actually in 2017 started a organ donor sort of registry. It's an app that you can register as a donor. And in 2017, local hospitals have started transplanting anywhere from kidneys to heart to lungs. And it's exciting because if you think about it, it is the ultimate gift of life when you're an organ donor. You can be a living organ donor, so you can give a kidney because you can live with one kidney. You can give a piece of your liver because you can live with a part of your liver, or you can register as an organ donor in the case that you pass away. You can give your organs to people who really need it and basically pass on the gift of life to them. So it's a powerful. It's a powerful sort of gift that modern medicine, in terms of advances, have given us the tools to do so. So,
how do you register to be an organ donor?
It is, I believe it's called the Hayat app, and you can find it online, and you can just register sort of your information.
Yeah.
And
so it usually communicates to the hospitals that in the occasion that you pass away, you are an eligible donor. Is that what this kind of process does?
Correct.
Yeah.
Correct.
And do people usually register to be organ donors, or is this kind of a rare phenomenon that people maybe it can be kind of I don't know, scary to think that one day you're going to part with your organs.
It
so
is.
People kind of, that commitment is like a commitment. It's like a commitment to death, that
Exactly.
it's
It is.
acknowledgement that one day you're going to die.
It's a different mindset, right?
Yeah.
Like, and it has its own sort of religious and cultural barriers to it.
Yeah.
But it is a different mindset of if I am thinking of being an organ donor, am I thinking of my own mortality, right?
Mm-hmm.
But when you think about it, and because I'm a physician and I work with patients who have been on dialysis for years and years or have had liver failure, if you think about it, that is the best way to leave your legacy, right? To have a heart in another child's, your heart beating in another child's body, or your kidney, so that they don't have to be attached to dialysis for life. So, but it is. I agree with you. It is a challenging concept to sort of wrap your head around.
So is it naturally then not very common that people are organized?
It's not, because it's also new to the country. I mean, there's certain countries around the world that you opt in, So and
what about in the United States?
It's not.
It's also not.
No, it's not. Like you can, when you, for example, go to DMV and register like your license, they ask you if you want to be an organ donor, but it's not like an system where everybody is registered as an organ donor, and then if you choose not to, you opt out.
Yeah, I understand. Yeah. And to what extent can a body accommodate an organ? So if you're a child and you get a grown person's heart, does it have to be somebody of the same demographic as you?
I mean, it has to be. I mean, when you think about it, it's also like size-wise, and so children get from children donors to some extent, and it goes through the science of like being a match, and that's a whole different science of, you need your organs to match, you need your infectious profiles to match, and so, but it's been done, and it's very common in other countries, and like I said, there are some countries where everybody's registered and you opt out if you don't want, and it is. And yet, people are on the organ list sort of registry for years just waiting for an organ.
SubhanAllah, yeah. So I know there's a lot of, we're going to now kind of jump into a very interesting topic, and I know there's a lot of controversy around vaccines. So let's talk about that. Some people say it's necessary, and there are people who say it's harmful. Can you elaborate on that?
Yeah, it's certainly a charged topic right now, especially in Europe and the US with the rise of the anti-vaccine movement. I'm a pediatrician first, and so I, dealt with, moms of sort of all walks of life. And I think what it boils down to is choice. Right. I think a lot of people say, like, why should vaccines be mandatory? Right. Why do I have to get my kid vaccinated before going to school? Why don't I have the right to say no? And I think it's very important to know that to be vaccinated and to vaccinate your children stops being sort of a personal choice and more of a commitment to your community. Right. There are vulnerable members of the community who cannot receive vaccination, and they rely on what we call herd immunity. They rely that the community around them are vaccinated so they don't get the infections. An infection that what we call an immunocompetent, or somebody whose immune system is intact, you can deal with it. But if that same infection affects an immunocompromised or a patient of, a cancer patient or an organ transplant patient, they might not be able to deal with that infection. They can die. And so it stops being what I think best for me and what I think best for my children to what I think best for other people and other people's children. And that is sort of the fork in the road because in medicine, there's informed consent, right? There's like my body, my own rules. But then vaccine is different. Vaccine is, if you don't vaccinate and a bigger portion of people don't vaccinate, you put other people's lives at risk. So I think that's, like I said, that's the fork in the road.
And so where do these concerns stem from? These concerns about vaccination for parents?
Yeah, there are multiple sort of concerns. I think the most controversial one is the link to autism. It all started with Andrew Wakefield in the early 90s. He published a paper, a small study in the Lancet, which is the most prestigious medical journal, where he first introduced sort of the link of the measles vaccines to autism. That paper has since been retracted by the Lancet because they found out that the results were fabricated. Authors that worked with Andrew Wakefield retracted their statement in support of that paper. His medical license was revoked, but the damage has been done. Since that paper, there's been dozens and dozens of well-powered and large papers disproving that link. But again, that damage has been done, and we've seen it in choice of members of the community not to vaccinate. And because of that single paper, the mortality and morbidity of measles increased. And so we saw deaths mainly in children because of that. And so the autism link is a big one. There's also concerns that, getting the infection in a natural way is better than vaccines. There's also the concern there are preservatives in vaccines that are harmful to our children. So there's several concerns. And I mean, I can quickly address each one. So the autism link, it has been debunked time and time and time again with very large powered studies. And, the main author is not allowed to practice medicine anymore. So that should tell the community something. The link with or the concern of preservatives and vaccines, it is true that vaccines contain some preservatives to increase its efficacy, but you get more preservatives or more of these elements in the food you eat, in the water you drink. The amount in vaccines is so small that in comparison, if you eat vegetables, you have that preservatives. And there's been no studies showing that it is harmful.
Here, I think, sorry to interrupt, I think it's really important to highlight that I think preservatives in the sense that they're conceived as artificial, right?
Exactly,
and
exactly.
There's a sense in which people antagonize, or we antagonize elements or stimuli that is artificial, but it's not necessarily the case, right? Because something can be natural and poisonous. Poison can be natural. Poisonous berries are natural.
Precisely.
So there's no particular reason in which things that are artificial, such as preservatives, necessarily being antagonistic or harmful, right?
Exactly.
Sorry, continue.
Yeah, and then there's the argument, for you to get the infection naturally is better than the vaccine. And that is not entirely true because, when our immune system sees the infection, we have some sort of memory cells, but that wanes. And that's why we get boosters, vaccine boosters, because our immune system cannot do its job 100%. And then you get people who are saying, you know what, our great-grandfathers and our grandfathers and, their fathers have lived without vaccine and survived. But you can ask even your family, you can go back 3 generations up. How many members of that family have lost children under 5?
Yeah.
So we don't ask those questions. We just see people who survive and, they survive without vaccines. And I think vaccines and antibiotics are the 2 most instrumental sort of medical advances. They changed the face of modern medicine. And because vaccines were so good, we don't see those the scary vaccine preventable diseases anymore. And so we don't see the need to vaccinate. But there are parts of the world right now still fighting with polio, still fighting with kids being paralyzed. The rates of measles are increasing in Europe, and the U.S. are making a comeback because of the anti-vaccine movement. And so I think I wanted to emphasize one thing is, as all things in life, unfortunately, it has become a very polarizing scene. And we focus a lot on the anti-vaccine movement, forgetting that a big portion of parents are not anti-vaccine, they're vaccine hesitant. And I think it's important for pediatricians, for doctors, and for other members of the community to not other them. It's not us versus them. We need to sort of close the gap and sit on one table and talk, because I'm a pediatrician, like I said, and when I discuss sort of medical care with a parent, I always tell the mom or the dad, you know your kid better than I do. I'm here to help. Let's talk about it. So I think we need to bring everybody in the table again and stop sort of labeling people, like we are the physicians and the scientists, we know best, you don't. This othering needs to stop so we can, sit on one table and discuss this, because it is causing lives.
Yeah, that's insane. Yeah, I mean, I understand. It's a very powerful topic, I think, and like you said, very divisive topic. And I think there needs to be a collective effort. And I'm sure many scientists such as yourself and medical practitioners such as yourself are, really working very hard in order to dispel these misconceptions, while simultaneously maintaining the trust of their audience and their listeners and the people who are looking up to them and sort of expecting helpful advice and direction and guidance. Right?
And you hit one point, trust, right? Because there's also talks of, vaccine being promoted by big pharma, and this is money making. As a pediatrician myself, I mean, the vaccine companies don't pay me to promote vaccines. The reason I feel so strongly about vaccines is because I have seen children die of vaccine preventable diseases. I think one of my hardest moments in my training was when I had to break the news to a mother whose child was fighting for his life in the ICU from a vaccine preventable disease. And she asked me one question. I remember just freezing in my spot. She said, could have a vaccine prevented this? And that was the hardest yes I gave her. And so I feel strongly about this, because I don't want, in 2019, and now we're going to 2020, I don't want to see children die of vaccine preventable diseases just because of misinformation.
Yeah, I completely get it.
Yeah.
And, these concerns that these parents have are, they're healthy concerns. And considering just the overflow of information and the overabundance of information, it's kind of difficult for somebody, a layperson such as myself even, to understand, because to us, somebody like me who is not a medical doctor, who is not even medically educated or literate, to me, it's like I see a piece of information from source X and source Y as being equivalent. And then what sways me, towards one and against the other is, my motivation. Because to me, they seem the same. I can't tell the difference between them because I don't know the difference between them. I don't have the requisite information in order to sort of delineate this from that and the truth from falsehood. So I do understand that. And even as someone who has a background in psychology, I do get that. So it is definitely a messy situation, and honestly, kudos to you for navigating this ground with such just a strong heart and a sort of the sympathy and the right empathy for people going through this.
And I think it's part of the onus needs to be on medical providers, right? Because we are in the age of social media, and the way to reach the community, the way to reach young parents is actually through social media. And because that is the platform where sort of misinformation spread. And doctors need to talk in non-doctor language, in, like you said, like a lay-term language, to reach the audience. Scientific language is, not the easiest to navigate. When you just search a Google search, right, you tend to go to the websites that are easier to read than those articles on PubMed that you cannot interpret. So I think also it is an onus on us as medical providers to be more active in our community, and social media is a powerful tool to do that.
Yeah. So another topic that's important to address is antibiotics and how we as patients and parents decide to use them. Can you tell us more about antibiotics and that?
Another very hot topic. Actually, this past Wednesday, the CDC came up with a report that we are now in the post-antibiotic era. And what that means is that the traditional first-line antibiotics are now unable to protect us from infections anymore because of the growing antimicrobial resistance and stemming from antimicrobial overuse and misuse. And it's a problem, right? Like, a segue or maybe a little derailment, but I'm going to go back to my point. But in the 50s in this country, people were dying because of vaccine-preventable illnesses, right? Malaria, tuberculosis, and smallpox. And now that we found the vaccines to them, patients are currently dying of bacteria that have that become resistant to multiple antibiotics. That we are forced to go to the shelf again and use older toxic antibiotics to fight those bacteria. And it's literally because of misuse and overuse. I mean, I'm going to give you like a simple example in the community, right? Whenever somebody has a common cold, they would go to the doctor and demand antibiotics, even though there's a big distinction between a virus and a bacteria. And you would say, it's not harmful. You can just give me the script of antibiotics and I'll be on my way. And actually, a viral infection has sort of a timeline. So you will start to feel worse before feeling better. And that's the timeline of starting antibiotics. And so patients think that antibiotics work. And, what is a course of antibiotics? But repeated courses of antibiotics causes resistance. We are colonized with friendly bacteria, right, in our skin, in our gut. And whenever they're exposed to these antibiotics and there's a real infection, bacteria are super smart. They have a mechanism to share sort of mutations that make them resistant to antibiotics. Your body is literally a ticking bomb, right? You need your friendly bacteria to help, but if you're wiping them out of antibiotics, you are basically eliminating the friendly bacteria and you're allowing them to share sort of mutations to the so-called, I'm using, very late term language here, but the bad bacteria to propagate, and it will reach to a point that no matter what antibiotic you throw at the patient, nothing's going to help. And you asked earlier about why I chose medicine, but the reason I chose infectious diseases, apart from it being super cool and exciting, I'm very biased, but I remember in med school, part of a microbiology class, learning about resistant bacteria and multi-drug resistant bacteria, and I would sort of challenge the professor. I'm like, okay, so what if we lost this line? What if we lost this line in terms of antibiotics? And I would write notes because I want to learn about antibiotics. And I said, okay, what if we lost this line? And he said, if you lost that line, you go to your patient's bedside and you start praying. And that just hit me. We are losing all our ammunition to fight these bacteria. And we will, like I said, we are in the post-antibiotic era. We need to act very quickly. Otherwise, the mortality and morbidity of these infections will continue to rise.
So what is the course of action then in your mind? I mean, I don't expect a really rigorous timeline, but, what is the expected sort of cause of action now from on behalf of medical practitioners?
Right. Yeah. Good question. So I think, there's several things that can be done in the community and then within the medical community. There's the awesome practice of what we call antimicrobial stewardship. So the infectious disease doctors become what I call the antibiotic police. And so they sort of work with other doctors to help them choose the right antibiotic for the patient that is not too broad, so that we can save our ammunition, if you will, for the more serious infections. So that's in sort of the hospital setting, sort of policing antibiotics. Within the community is basically educating patients that, not every cold needs antibiotic, discuss this with your doctor. There are a lot of areas in the world that antibiotics are still over the counter, which is, not a great idea because, you need a diagnosis from a doctor if this is a viral infection or a bacterial infection. So I think tackling misuse and overuse comes from stewardship, whether it's in the community or in the inpatient hospital setting.
So there's a way in which we are not moving beyond this, but we're actually still trying to tackle it using this policing of antibiotics. And because I was imagining this sort of post, what do you call it? The
post-antibiotic era.
Post-antibiotic era. I was imagining that we maybe have now evolved mechanisms against the antibiotics, and now we need to think of a completely different route of dealing with them as opposed to still being within that realm.
We have.
Oh, we are.
We have.
Right.
It's just and there are areas of the world that, you have infections that are resistant to every antibiotics known to man. So we
have to advance beyond antibiotics at this point.
Exactly. And there's things in the pipeline. There's an exciting science bacteriophages, which is basically viruses that infects bacteria that can be engineered to fight bacteria, which I think is pretty cool and awesome and very sci-fi.
Yeah.
You have the new technology of CRISPR, gene editing, same thing to sort of circumvent the bacteria's defense mechanisms and fight it that way. So there are things in the pipeline. It's not immediate, right? That's why we need stewardship. And stewardship starts not just from doctors, but even just educating community members. So yes, we are in the post-antibiotic era.
Yeah.
Parts of the world are, seeing really resistant bugs.
It's interesting to hear how we are shedding sort of that skin in our history, and sort of now we are it is a present history. We're moving to another age.
It is. It's a pendulum, right?
Yeah.
Like we were at a time where we were fighting bugs and we were, losing lives because of viruses and bacteria we can't even see with our own eyes and we can only see under the microscope, to finding anti-infectives and vaccines. And now the pendulum have swung towards these same organisms or different organisms becoming resistant to ammunition. It is a other side of how, because of modern medicine, now we are seeing the pendulum swing the other way.
So yeah, I suppose we create our own solutions, and these solutions birth problems, and then we have to kind of think of counter solutions for these problems.
Exactly.
And right, so let's go to go back to kind of your own history in medicine. And can you give us a description of how you moved from entering college at the very beginning and then to where you are today? So that kind of sets the tone for people who are listening to this and are interested in developing into this field and becoming potentially practicing doctors.
Right. So my path was a little different, but I can sort of tell you my personal journey. So after graduating high school at 17, I decided to apply to medical school, and that is the sort of the UK or the Europe system, different than the American system where you have to do 4 years of like bachelor's and then apply to medical school. So I applied straight after high school. During my time, I had to do a foundation year with the university and then do 6 years of medical school and then do an additional transitional intern year. Are you keeping count? Because I'm like horrible with that. So you're gonna tell me the number after I'm done. So after 8 years, right? And then after graduating medical school, and I did a year of internship here and being a teaching assistant, which is another thing that's close to my heart, medical education and, students. And then I applied to the U.S. For residency program, and I had to undergo a match. And that's a whole sort of complete different world. The international medical graduates, it's becoming more and more difficult for international medical graduates to apply to the U.S. It's very competitive. It basically you need several exams, what we call the USMLEs or United States Medical Licensing Exam. These are MCQ-based exam. The step 1 is an 8-hour exam. Step 2 is a 9-hour exam. And then there's another exam where they test your clinical skills. And then after you have those 3 exams done, you need to have, and I'm explaining sort of the route through U.S. training program. This is different than staying back in the UAE. And doing clinical electives, basically working in hospital-based settings in the U.S., doing research and, getting letters of recommendations, and then entering a match. And that is basically competing with literally everybody outside of the U.S. for positions in the U.S. that are limited. There are programs who have like 40 seats and have only 3 seats for international medical graduates. So that's how competitive it is. I mean, it's and I don't want medical students who are listening to us right now think that it's impossible. I always say it's not impossible. It is challenging, but it's doable. And you just need to navigate the system smartly. And then after you get in, when you think that's the hardest part, and then you go through intern year, which is the first year in residency, which is known in the U.S. as the hardest year in training. U.S. training programs are notoriously known to be like a boot camp, right? Recently, the ACGME, which is like the organization to sort of monitor training programs in the U.S., have limited working hours to 80 hours per week. That's normal. And some programs even violate that 80 hours a week. We do 24-hour calls, 28-hour calls. And so it's a very sort of difficult system, but it trains you to be a resilient doctor. But with the caveat that you also need to have a good support system and coping mechanisms. And, at the end of the day, you need to be healthy mentally, emotionally, physically to take care of your patients. So that's residency. So intern year is the first year, and then you go through residency. I went through pediatrics. It's a 3-year program. And then I applied to the match once again to go into fellowship. And right now, my 3rd year of fellowship, which is the final year. And so every step of the way, it's applying to the match, interviewing all over the country, and then the applicant ranks programs and the programs rank applicants. It's a match. So you don't choose where to go. You just pray that you go to a place of your top 5.
Yeah. Wow. So 12 years? Is that the number?
Yeah, 13, 12, yeah.
Oh, wow. That is a lifetime in medicine. That's amazing. And that's just kind of the beginning, I guess, for you, right? I mean, there's, I have a question here. And I think that maybe, I don't know, I hope not an intrusive question, but I'm curious to know here, it seems like it's demanding, and it's been demanding. And what it sounds like is that it's been a very challenging 12, 13 years.
Mm-hmm.
And for someone who wants to obviously have a family life and a social life, and, you do writing and other things, how do you manage to kind of juggle these things, especially as being a parent? So not specifically as a mother, because I know, you can be a father and a mother and equally have a demanding job. It's kind of about having your sort of set dynamic between you and your partner.
Right.
But how do you sort of do that and balance being a doctor and also kind of take care of yourself?
No, absolutely. I mean, full disclosure, I am not married and I don't have children. So what I'm about to say is just, sharing the experience of my friends who do. Unfortunately, the system is not 100% designed, especially for females who have kids. I mean, it could be better. I mean, it's, there are mechanisms in place to support a female physician and a physician mom, but it's not perfect. And I think we need to see it as we need doctors of all competencies, right? And that includes women, and a woman should not choose ideally between forsaking her career, right, and being a mom. It's challenging, but have had multiple friends who have balanced it beautifully. Is it hard? It is, but they found this right balance to do it. So it's definitely challenging, and I think it's a system-based problem. I think the system should accommodate working mothers better, especially sort of in training. So I can't personally sort of speak on that experience because I don't have children. But to answer your other experience, how do you have a life outside medicine?
Yeah.
I need to have a life, otherwise I'm going to get burnt out. So I need to find time. And as much as 13 years of constant training sounds very intense, I enjoy traveling. Like even in residency, whenever I have what we call a golden weekend. So in residency, in a month, we have 4 days off, and 2 of them are combined in what we call a golden weekend. Whenever I had that, I would travel. I love traveling, just, visiting people, learning about different cultures and whatnot. I'm an avid reader. I do admit that have substantially decreased while I was in medical training, but I continue to write, which I feel is a win for me. And it helps that I have poet friends to every now and then encourage me, have you written something recently? And I do have another way to keep me sort of accountable to address my writing side is I do share an Instagram page with my sister. She's an artist and I write poetry, and I post in that Instagram just to keep me accountable. And then Untitled Chapters also share my works.
What's that Instagram of yours?
It's called Moths and Fireflies.
Oh, I see. Okay.
And you will know the story once you go into why it's Moths and Fireflies, but it's based on a poem.
Okay.
And then Untitled Chapters also share my work. So
nice. We're going to follow that.
Oh, awesome. Yeah. So to answer your question, I need another outlet too.
Yeah, I see. Okay. Yeah. Right. And so just to wrap things up, what's your final word of advice for people who are looking to pursue your area? I guess medicine at large, but also, pediatrics and maybe infectious disease.
You are a lifelong learner, as evident by sort of the many years I spent. But it is, as much as it's a, it's daunting, a challenging job, but it's an exciting job. I cannot imagine doing anything else. And like I said, it's just an honor and a privilege to serve patients, learn from them, to do science and research and learn from experts and be part of that picture. I would wrap up with 2, not to sound cliche, but 2 quotes that helped me in intern year. Intern year was one of the hardest years of my life because that's the year that, I left home at 25 from medical school, and I've not lived outside of home ever. So I always joke with my American friends, my 25 was your 17 when you left for college. And so imagine just doing your whole living alone and paying bills. And so during intern year, the multiple times I thought of quitting, and you might be surprised, oh, why, we rarely talk about vulnerability in medicine, right? And we rarely talk about our own failures. We always talk about our successes. But whenever I have young mentees or, young medical students, I always tell them, oh, no, I've thought of quitting, multiple times. I didn't. 2 things that helped me get through is a quote. I don't remember the author of the quote, but when God wants you to grow, he makes you uncomfortable. Growth is not pretty. Growth is painful, right? In order for you to go into your metamorphosis, change is difficult, but you need to go through that process. So whenever I feel like I'm out of my zone, I know that I'm learning something new.
Right.
And I need to embrace that.
It's a good indicator then.
Yeah.
It's a good indicator.
Yeah. And then the second quote is, I believe it was by Steinbach, now that you don't have to be perfect, you can be good. I think medicine attracts A-type personalities. And in med school, you can be that, right? You can study for your exams and try to score sort of the top scores. But once you go into real-life medicine, patients humble you. And you don't always have the answers. And you give your best, but you're also human. And so I think just giving ourselves some slack, right? We're not superheroes. We doctors are in the sort of highest, we're dealing with field of life and death and everything in between. And so I think we need to be kinder to each other in that field because the system is not kind to us. So those 2 quotes helped me during intern year. And as cliche as it sounds, it just follow your passion. I think you need to you need to pick something that makes you wake up in the morning every day. And despite, how your day goes, you're like, you know what? This is what I want to do. I love what I do.
Yeah.
And so you need to find that passion to keep you going.
Yeah. Wow, that's a pretty powerful note to end on. So I think then that concludes our episode. It's really been great talking to you, Dr. Fatima. Thanks for coming on the show.
It's a pleasure to be here, and good luck for you guys. It's exciting to have a podcast culture finally in the UAE. We're talking sort of off screen or whatnot about like all the, big podcasts of Radiolab and Hidden Brain, and, I anticipate a great, bright future for this one.
Thank you. Yeah, thank you. We're working towards that. We'll see how it goes. Thanks a lot. That was Dr. Fatima Al Dhaheri, Pediatric Infectious Disease Fellow at Boston's Children's Hospital. To listen to more episodes, you can find Good Question on Apple Podcasts, Stitcher, Spotify, or wherever you get your podcasts. If you have any questions, comments, or suggestions for what you'd like to see from us next, you can reach us at GoodQuestionUAE on Instagram and Twitter, or email us at info@goodquestion.ae. Good Question is a production of the Youth Science Council and the Office of Advanced Sciences in the United Arab Emirates. Produced and directed by Hind Al-Ali and Hayat Al-Hassan. Sound design by Gareth Chen. Sara Al-Ali is our editor. Our social media and communications are managed by Mohammed Al-Mansouri and Fatma Luta. And I'm Sara Shirbaji.